to go on Twitter, that's because Twitter's a really good place these days to find out about mental health research and mental health policy and what the new developments are in the field. And one way of acquainting yourself, a really good way of acquainting yourself with what's happening around here, as well as in the broader mental health world, is to start following some key accounts, like our own division's account on Twitter. Okay, and that's a list of some of the senior staff in the division. It's divided up in these sections, but it's really one large unit in two open plan wings, where if you wander about, you'll be able to identify the key staff working in a range of areas. And I think it's a unit that people find quite a sort of friendly and interesting atmosphere, because people do work quite closely together across a sort of range of specialties and types of topic. Okay, so that's where we are. We're located in this division. So within that, we have this broad MSc programme that actually encompasses two programmes, the large clinical mental health sciences MSc and the smaller mental health sciences research MSc, which is mainly done by a small group of clinicians. I don't actually think there's anyone here today that I know of who's on the mental health sciences research route. Is that right? Okay, so in that case I'll avoid confusing you by talking about that route, and I'll just talk about clinical mental health sciences for you. So the MSc modules are sort of span core modules, some and then some optional ones, some of which are mainly focused on research methods, and others of which have a sort of combination of clinical and research components. Everyone does a double module in which we survey in quite a practical way the range of methods that are used in researching mental health. And most people on the clinical pathway also do our double module in clinical mental health, which Joe will talk about. If you've got quite a bit of clinical experience already, that might not be appropriate for you. If you're not sure, talk to one of us and we can advise you on whether it's a good idea to do it or not. You don't have to do statistics compulsorily, although for some reason almost all the year that's just gone through did do statistics as an optional module, so that's a frequent choice, although it's compulsory on the research module and not on the clinical one. There are then, so I've slightly misnamed the first of the research methods one, there's a neuroscience methods module. There's an epidemiological methods module, which is mainly about big cohort studies, big surveys, methods for understanding the kind of etiological factors, the causal factors there are in mental health problems, understanding what influences the course of mental health problems. We then have a new module which is around mental health and social and global context, which looks at social factors in mental illness in quite a sort of worldwide perspective, as well as in the UK, and at the kind of interventions that address the worldwide mental health problems. And you'll hear about that, and also about our culture in the clinic module, and Nicola, who's here at the back, will attempt to explain to you what the difference is between those modules and how you should choose between them, or who should decide to do both. There's then current research in psychosis and bipolar module, which I'll talk to you about. Similar sort of clinical research focused modules in depression and anxiety, intellectual development disability, which includes autism. We have two dementia modules, one a sort of more basic one and one a more advanced one focused on management. And we finally have a module that's been revised this year that looks at evaluating interventions in mental health of various kinds, and also at how those evaluations get translated into policy and service planning. So that's the range of modules that we offer here. There are also a wide range of modules from elsewhere at UCL that people can undertake on an optional basis. There are some variations. We try and make as many as possible fit into the timetable, but it doesn't always quite work. So you do need to find out about timetabling issues if you're contemplating doing these, especially as some of the other departments have a habit of changing the times of modules just when we think they've fitted them in. But these here are some of the ones that you can do within our programme, and people invariably when they get here uncover modules that we've never heard of that they then ask to do, and we very often will say yes to that. We're quite happy for you to choose quite a wide-ranging programme if you can find things that fit in. Okay, so I won't tell you about that. These are the rules for the Clinical Mental Health Sciences module. If you're doing the Clinical Mental Health one, then you'll be on the right, and as well as the 2 double modules, you'll choose at least one other of our clinically focused modules, so those current research ones mainly, plus any 3 other modules. And you'll also do a research or a clinical project, which Vaughan is going to tell you about, and which takes up a third of the marks for the course. Just to tell you broadly about our approach to assessment, there's more coursework than anything else, but we do have some short MCQs to assess whether you've got a broad knowledge of particular modules, not in all of the modules, but in both of the core modules and in some other parts of the course. Our coursework we try and make as kind of real world as possible. So you're doing things like designing a poster in the kind of style that you might present at a conference, writing a protocol in a sort of established format for a systematic review of the literature. The final project, if you do a research project, we ask you to write a paper that's formatted to submit to a journal, and also to write a research blog. So we're very much trying to get you across the transition where you're ready to function in the real world of mental health in some relevant post. I interviewed yesterday for a new research assistant on a study working with me, and shortlisted were, I think 4 out of the 6 people we shortlisted, as well as the successful candidate, were people who've been doing MSc. And I was very pleased to see how confident people are in presenting in a style that's acceptable to kind of professionals, that's acceptable to sort of people functioning professionally in the field of mental health research, how kind of realistic people's understanding is of mental health services and mental health research. That's where we want to get you to, basically, in the course of this year. As well as the modules, we have afternoon sessions, including a journal club in which we ask you to read significant papers of the past 5 years, and people rotate to do presentations on those group presentations, and that makes up a small portion of the marks for the final project. And on Wednesday afternoon we offer a series of other sessions mainly focused on supporting your careers and on helping you with your projects. So one session that's proved strangely popular is the So You Want to Be a Clinical Psychologist session. Don't suppose any of you do want to be clinical psychologists, do you? Maybe you, we find it's a popular choice. So we've organised various activities to support you with thinking about your careers, including, importantly, some about the other options. And we find at the end of the year that people's idea of what they could possibly do tends to have broadened out quite a bit. And we find, although some people are still very clear they want to do clinical psychology, as many people think at the beginning, actually people are also discovering that there's a wider range of interesting careers related to mental health that they might consider. Okay, finally, the support that's available is from quite a few people in the division. So we have a sort of core team of people part of whose jobs involve supporting the MSc. I'll ask those who are here to just introduce themselves to you now, starting with Vaughan, who's on the door.
Hello, so I'll have myself visible. Hello everyone, my name is Vaughan. I'm one of the lecturers on the course. When I'm not here, I'm a clinical psychologist down in South London, where I work in psychosis services, and I teach on kind of across the course here and there, but I'm one of the module leads for neuroscience.
I'm Sarah Rowe. I'm one of the lecturers on the course, and I'm one of the module leads for the core research methods module.
Hi everyone, I'm Jo Billings. I'm one of the core members of staff here, one of the lecturers. I teach across the course, but I also am the lead for the clinical mental health module and teach on depression and anxiety as well. And a bit like Vaughan, when I'm not here, I'm a clinical psychologist in the NHS specialising in working in trauma.
Hi everybody, I'm Nicola Morant. I come from a background in social psychology, and I do research on areas of mental health using qualitative methods. So I teach qualitative methods and support people doing dissertations using qualitative research methods. I'm also going to be co-leading the new module on mental health in social and global context.
Hi everybody, my name is Gemma Lewis and I'm a lecturer on the MSc, and I'm also a postdoc in the division. I do depression research predominantly, and I'm one of the module coordinators for the statistics module, and I also teach on the epidemiology and depression modules.
So we're some of the sort of main people who are running the course, but pretty much everyone in this division is also involved. Chris is our administrator.
Hi, I'm Chris Good. I'm your MSc administrator. I'm actually based here in the department.
So Chris's email address is probably the most important one to know, although she may not thank me for saying that. But so that's the sort of core MSc group. There are also postgraduate tutors who have an overall responsibility for postgraduate teaching. The modules, as you'll see, each have a lead, and when you have questions that relate to the specific content and assessment methods for a module, we'll ask you to go to them. We'll also divide you up into study groups, which contain sort of around 10 people per group, and on which you'll work on a number of sort of shared tasks, particularly in the core principles module and in the journal club. And that's both because we find that's a productive way of your learning and learning together and learning from each other, and it's also a sort of not so covert way of making sure that you all start to get to know each other, which is another thing that we find is helpful both academically and socially. And each of those study groups has somebody who's at a sort of PhD student, postdoc level, and also one of the academics attached to support that group. So those are two people who'll know you and have quite a bit of interaction with you while you're here. You'll also have a personal tutor who's one of the academic or research staff here and oversee and provides pastoral and academic support. We also have a PhD student who's a mentor in a sort of more non-academic sense for you. She's called Sarah Dowland, and she'll come and explain her role. We have somebody who coordinates placements called Taylor, who's one of our graduates from 2 years ago. And she and another of our graduates from 2 years ago, who's called Jess, they're both starting PhDs this year, having been research assistants since finishing the MSc. And they are going to coordinate a bit of a sort of social programme that people said they were quite keen to have in the division, and they'll do that, I think, with some of you, and there's a bit of resource to do that. So that's who's who. I've said about the study groups really already, so I'll stop there. Any quick questions? We'll allow a bit more time for questions at the end, but any questions about any specific aspect of that? No. Okay, Sarah.
And the slides on there. This is for core research. Oh. Did we bring the slides? Okay. I'm not going to worry about slides. As I mentioned, I'm one of the module leads for the core research methods module, along with Sonia Johnson. And so this is the compulsory module that you'll do. It's a double module. Essentially, it's to give you kind of a very comprehensive overview and some key skills to do with research methods that we use within clinical research. So there's quite a variety of topics that you'll cover within this. Anything from how to create a measure and test the psychometric properties of it, to how to conduct systematic reviews. We also give you a taster of neuroscience, and also epidemiology, statistics, and qualitative research. So you'll get some good sort of underpinning knowledge to help you going on to other modules as well. The module itself runs on a Friday, so it's the first module that you'll do in the first term. In fact, on your induction day, we'll kick off in the afternoon with the first session, so that's at the end of September. And then lectures run through until, I think it's around the 15th of December. Now, yes, the classes are on a Friday afternoon. Sorry, I'm going to break that to you now. But you know, a lot of it does cover large group teaching, but lots of it is in, we do parallel sessions. So in fact, you're in much smaller groups, so you can do practical things. That way your brain's hopefully more engaging and things like that on a Friday afternoon, because I know it's a bit tough going. But there are 3 assessments that you will do for the course. So there's a third that's attributed to essentially developing a psychometric measure, and putting together a plan about how you would test the psychometrics for that. Another assessment is doing a protocol for a systematic review, also worth a third. And then you'll have an MCQ exam, although that's at the beginning of next year. So they're worth a third each. For the 2 core pieces of coursework, you do some group practice work first. So you've got formative assessment, and in the study groups that Sonia mentioned, you will be able to practice that and put that forward and get feedback on it. You know, alleviates some of the work, but also does get you practicing and getting feedback before your actual summative assessment. And essentially, one other thing I would say about this is that if you're going to do this, if you're doing the course flexibly rather than part-time, we would recommend that you do this module first, or at least early up. The reason for that is that you know, most of what we do is then built on in other modules. So you know, lots of these skills will transfer over. So it's a good place to start.
Any questions?
Oh, sorry.
About
I should have said that.
Yeah.
Any questions? I just
quite a large and lively group for it. And basically the aim is over 8 Friday mornings to give you an overview of the most significant current areas of research that are relevant to the causes and the treatment of psychosis and bipolar disorder. And we have a mixture of external and internal teachers. With the aim being to make sure that you're exposed throughout to people who are very much at the forefront of research in their field. And so one thing I'm quite proud of about the module is that each year we have, and we've just booked him to come again, Sir Robin Murray, who I think is the world's most cited schizophrenia researcher, is giving one of the talks. I've just booked him for week 3 of the module, so that's something that always gets good feedback. But so there'll be people who are do a variety of biological, psychological and social research, but who are all very actively engaged in working on their topic. During the module there's a group task which involves getting you to do some presentations, bringing together the evidence that's been presented to you on causes and on treatment of psychosis and bipolar. That happened in the last week. And the assessment consists of a 1 hour 30 question MCQ test, which just looks at your broad knowledge of what's been covered in the module. And then for 2/3 of the credits you can pick. We give you a list of about 30 questions, or you can make up your own, and we ask you to design a poster, produce a poster. We'll help you with the actual production and present it to staff and other students, summarising the evidence on a question that you've chosen around the concept of the module that's of particular interest to you. And this shows you, if you just want to take a look, this is the range of questions and topics that we look at in this module. So it ranges from looking at genetics and neuroimaging and what their contribution is to understanding causes, what future contribution they might make to treatment. We then look at cognitive models and what the cognitive deficits are in psychosis and bipolar, how they might be addressed. There's quite a bit of teaching on psychological interventions for psychosis and bipolar and how they're currently being researched, and things like virtual reality interventions and stuff that's at the current forefront of psychological interventions. We look at early intervention and attempts to improve prognosis through early intervention, attempts to improve prognosis through targeting cognitive functioning. There'll also be some stuff on pharmacology and where we are with drugs to treat psychosis and bipolar. And finally, looking more broadly at social issues, we look at families of people with psychosis and bipolar, the difficulties they experience, and the evidence on how they might be helped, as well as the evidence on the social difficulties that people with psychosis and bipolar have, and what interventions might help them. So, as with the other current research modules, our aim is very much to bring together the kind of neuroscience evidence with psychological and social evidence. We very much don't see those as in opposition to each other, but as things that we should try and bring together and integrate in our understanding of these conditions. Okay, so that's my module. Anyone got any questions or thoughts? Love you to ask some questions.
Yes. Is this information going to be available for us after today?
Yes, well, we can make the presentations available. Yeah, and
it's on the website as well.
There's also stuff about all our modules on the website, which I think covers some similar ground. But this is the time for you to ask anything that you're kind of particularly wondering about these modules. Anything about this one? Anyone considering doing it? Yeah, no, we find a good number of people do good, not an empty lecture theatre next year. Excellent. All right, so I think maybe it's most logical if I hand over to Claudia. Yes, Claudia's the...
No, Vaughan isn't
Yes,
on our
but
timetable.
Claudia's
I
here.
love it because I've got
Yeah,
the
and Claudia needs to go.
We don't have your slides at the
There
moment.
are no slides.
There are no slides.
No?
That's fine then.
I'm just going to speak from the heart. Hello, I'm Claudia Cooper, and with Elizabeth Sanderson from the Marie Curie unit, we have led the dementia module over the past few years. We're actually in the process of handing over to Nick Bass, who will continue with that work, probably with someone else. So the people you see on the ground come October won't be us, but I can tell you all about it. It's generally been a popular module, I hope, and one that the students have found very interesting. And really, as Sonia was saying, for psychosis and bipolar disorder, we're trying to teach you a really broad range of concepts around the diagnosis of dementia as well as the lived experience of dementia. So the teaching takes you through how to assess cognition. We have some very popular sessions with our clinical psychologist, who is a neuropsychology expert, about how clinical psychologists do that in practice as well as how it's done in research studies. We talk about mild cognitive impairment through to dementia. We talk about how the diagnosis is made and understood in terms of biological research and imaging, and we spend some time looking at psychological approaches, for example, to managing agitation and the mental health problems such as depression and anxiety that are very common in people with dementia and also in family carers. And we also have an interesting half day talking about the ethics of dementia, because we have a population, many of whom lack the capacity to decide things like whether or not they want to take part in a research study for themselves. And so a whole legal framework has built up around that, and I can see people in the room who are very familiar with that framework. And it's another very interesting area. The module is assessed through a presentation, and so in the current format we give you opportunities throughout the course to practice presenting formatively, so in a supportive environment where you're not assessed, to prepare you for that, and also to prepare talks on a number of topics and send them to us, and we turn it around and give you some feedback to help you to develop your presentation slides and presentation skills. So that was mainly what I was going to say. We also have quite lots of people that do attachments, clinical attachments in the area of dementia. I've had a couple of emails from people today who I'm going to meet with who may be here, I'm not sure. And there's lots of opportunities to get involved in that way, and also to do research projects. So one of the current MSc students is currently collecting research interviews, evaluating an intervention in which we get people with dementia together to talk about the types of food and dietary approaches that might be helpful in maintaining well-being in dementia, and she's giving them questionnaires before and after as a sort of early pilot study, which we may well take forward as a full funded study, but there's lots of interesting opportunities like that for MSc students to get involved in a research programme. So do email Liz or I if you have any questions, and I hope to see you on the module. Is anyone planning to do it? Not so far. Well, it's always quite full, isn't it? So maybe when you've had a chance to think about
Yeah,
it.
exactly. I'm sure your speech will have moved many.
Absolutely, they're stunned. Thank you very much. Bear with us, it wouldn't be a presentation day without some IT issues. Who's up next?
It's warm. Talking about projects.
Thank you very much for coming, everyone, and we look forward to seeing you in October. So I'm just going to talk a little bit about the projects that you do on the course. So firstly, they're really important because it's a third of your total mark on the MSc. And secondly, it's important because the projects are really at the point where you take all of the knowledge about the methods and all of the knowledge about the subjects you've been taking based on the modules you selected, and actually turn them into some new and innovative research in mental health. So we have a kind of slightly different approach here in UCL than some other MSCs, in that we're very, very focused in that you're being an active part of research happening here, and that you're also producing things that you can go through and contact supervisors, each of whom are offering projects, usually within their research group, for you to take part in. And the projects cover pretty much the whole range of research that we do here as a department. So we have probably the world's biggest dementia research centre, which covers us, which covers the Institute of Neurology. It's a massive part of UCL, and we have a big dementia research project happening here. And so there are plenty of opportunities to be involved in that, whether that's the social aspects of dementia or whether that's the neuroscience of dementia. We have a lot of neuroscience going on here, and so if you're interested in things like understanding EEG of early onset psychosis, that's the sort of project we're offering. We've got a large kind of, Sonia's mentioned, a large interest in kind of social psychiatry and kind of complex social interventions. So if you're interested in stigma, if you're interested in evaluating services, if you're interested in optimising services, we offer plenty of research in that area. And we also have some kind of people doing diverse, research, psychiatry. We always have, and you have to write a blog post to communicate your work to the general audience. So these three things are really core skills in being a researcher, but also engaging the public in mental health research, because mental health is all of our responsibility. The other kind of aspect we provide is not just learning from the methods courses and learning from the subject-specific courses, but on Wednesday afternoon we have a kind of whole range of courses, whole range of lectures, which are about kind of support for you as researchers, but also you as professionals. So we will have lectures on writing up your research results, kind of selecting journals, writing for the public, a whole range of things, but we also provide a whole series of lectures on career options, of lectures on dealing with ethical issues in clinical work or as a researcher. They're really focused on kind of thinking about your professional development, how we can support it during the course, but also how we can support it, after the course. What we try and think of is that, most of the folks that we have on our course are likely to be the leaders in the future of mental health research, mental health practice, and mental health policy. And we want you to start off very much with that in mind, and whatever you end up in, we want you to have a good understanding of both the practice and theories of all of those areas. Have you got any questions about projects you want to ask me? This is one that often comes up, about stuff you may be interested in or how people go about them.
If they have a neuroscience element in their research project, would we be trained to use things like EEG or MRI?
Yeah, so let me put it this way. You won't be asked to do any project you don't have the training for.
Okay.
Yeah. So sometimes people ask about things, they say, can I do fMRI for my research? Like, some stuff is just really complicated. Having done some fMRI analysis myself, it won't be the easiest thing to start from scratch and learn all of that. However, for the people doing, for example, EEG research, we're well used to MFC students collaborating with us and working with us, and often in those situations we might have kind of specific analyses or specific aspects of a larger project we're really keen for people to get involved with, which will give you a good understanding and some experience of using those analysis tools, but in a year you won't be able to kind of fully kind of grasp all of those methods just because that's what you learn over a PhD. But we want people to have that experience, so then they can go on to a PhD being able to say, I've been involved in the EEG research, I've been involved in psychiatric genetics, I've been involved in epidemiology. Any other questions about research projects, or if you have any interests or what sort of stuff you might be interested in?
Is it possible to do a project in a clinical setting where you don't have a researcher but you collect data from a clinical setting that you work in? Or?
Yeah, absolutely. So it's worth saying we have kind of two formats of the research project. So when you talk about doing research in a clinical setting, lots of people do that anyway. That's a really common thing. It's worth mentioning, I've talked about these three components of projects: kind of writing a scientific paper, essentially doing a presentation and doing a blog post. What we offer, which typically only kind of a small number of people take up every year, but you know, is something that we also think is important. It's something not entirely helpfully clinical project, because they're all clinical actually. But this is about if you wanted to do your MSc dissertation as a bit more of a traditional dissertation, so like whatever, 12,000 words. Topic, but very much in the format of the sort of policy recommendation documents you see from the likes of Mind, you see from the likes of King's Fund. We're really happy for people to do that. So if you read mental health reports from the likes of Mind, for example, they recently produced a report on use of restraint in mental health services. And they did some survey using existing data, and they talked to individuals and got feedback and so on. This is a little bit different from kind of scientific paper, equally important, and we support clinical projects in both of those forms.
Maybe it's worth just saying that there are some limits on what's possible partly due to the NHS ethics process, aren't there? So it's quite hard to do a freestanding research project in a clinical setting, but there are opportunities to join in with what's already going on, aren't there, that provide people with that kind of experience.
Yeah. So maybe the details seem a little bit kind of cloudy at the moment, but service evaluation projects, in other words, evaluating a service rather using a service to answer a scientific question, tend to be much more achievable, partly because NHS ethics now involves a small team and a lot of kind of dedication and stuff. But lots of people do clinical research already involved in established projects. Any other quick questions? Project front. Fantastic.
Okay.
Thank you very much, everyone.
I think we now go on to the student experience part. Are there any PowerPoint presentations?
No.
Or are you just
no.
going to talk? No. Good. That's right. Okay, go for it.
Hello, my name is Lauren, and I'm a full-time student of the course. I had taken 2 years out of education and was just travelling and doing nothing psychologically relevant. And I felt really nervous coming because I just thought, oh, everyone's going to be out of uni or been doing these really valid kind of placements. But if anybody else is in that position, don't worry, I've been fine. And I think a really good one, so the research methods and the clinical module. And then I also did psychosis and bipolar, depression and anxiety, an external module which was eating disorders treatment, and the statistics module. So if you have any questions about those, feel free to come and ask me about them. And then I've also done a clinical placement this year, which Joe organised, but I think, as someone said, it's going to be slightly different. I think someone else is organising it this year, but I'm sure you'll be kind of informed about that as the process goes. But they're really, really good opportunities. So this year I've worked in an IAP service, and I've been doing assessments for people entering the service with all kinds of depression and anxiety, and sometimes not depression and anxiety. And it's been one of the best things I've done this year. I work in the NHS, so that's a really